I'm really pleased. This is my first public event, and so it's a chance for you to get to know me, and I hope it's the start of many conversations that we'll have into the future. I do have a PowerPoint. Part of the reason for the PowerPoint is this is the first public display of our branding and our logo. It's been developed through consultation. We had a lot of feedback on the type of image to represent the role of the office, and so the symbol of the tree is what we've developed in terms of symbolising growth, strength, recovery, and I hope you can see that the leaves are actually speech bubbles, and they symbolise speaking up, the strength of speaking up and the strength of communication. So that's the thinking behind this logo that's been developed. I thought it'd be helpful to just set the context, the history of the office, because while I just started, I think this is my 7th week, and we're about to open the doors on the 1st of July. There's been a long history leading up to the establishment of my office, or our office as I would like to say. I've got Alex Blemmersborg with me. I don't know if any of you have met Alex in the consultations. What happened is that there was an establishment team developed back in May, and the establishment team's been working hard for over a year now in really hearing from consumers, carers, services about what's been working or not working in terms of complaints, and what are the key concerns that need to inform how we approach our work. And so I think many of you might have been in those consultations, and if you have, I really thank you for the feedback and the reflections you've given to us, because that has formed the foundation of how we'll approach our work. And we'll need to keep talking with you and hear about how you think things are going in terms of the reforms, how you find your experiences with our office, what you hear about how things are working, because that will make us do the best possible chance of making this achieve the aims that we're hoping for. So as I said, that we're going to be opening the office on the 1st of July, and this is the history that we've had. Now the consultations, I thought it'd be useful to for you to hear about what we heard from the consultations, and if you've got any questions, I've got Alex here who was actually involved in many of the consultations. So they were extensive. They happened over the last year in 2 rounds. The first round of going back and having the conversations about what are the issues in people's experience with mental health services, with trying to raise issues and complaints, and what might an effective complaints process be. And then that informed thinking about, well, what would be the important things about a specialist complaints body like we are now? How would we need to do things differently? And so there was another set of consultations that happened where that was fed back, and we got further ideas in terms of what would be the most important things for us to take into account to make this work. So what we learned was, not surprising, is that people need to be heard, they feel they have to be respected, and they have to be confident that their concerns will be treated seriously. That was a really strong theme in the consultations, that it's hard to make a complaint. For those of you who don't know my background, is that I've just come from working in a similar complaints commission, the Disability Services Commission, and was involved in establishing that office. And the similar experiences people have had with disability services is that it's really hard to make a complaint. No one wants to be seen as a complainer. And the worst thing I think people can feel is that if they're called a complainant, we need to change that language. It's about people raising issues rather than complainants. It can have such a negative connotation. Any complaint service needs to really recognise that it's not easy. It's not easy to raise issues, and that any issue raised needs to be treated really seriously. In the consultations, when people were talking to the team about what would be important about how we did our work, these were the things that came up. The most important thing is about listening, really feeling that the person hearing the concerns listens with empathy, really tries to understand what the experience is. Because complaints about mental health services can be about very serious, heart-wrenching situations, really potentially adverse events for people. And so the person who picks up the phone and hears people's complaints needs to be prepared to really give the person time to talk through what that experience was and what might need to happen to make that experience be addressed and to prevent it happening again. In terms of complaints processes, we also heard that it's so important to share information and to have regular contact, that if you're raising an issue, you need to be confident that it's going to be followed up and that there's regular communication about where things are up to. It's also important that you need to feel really safe about how your concerns are going to be dealt with. Sometimes people need to, and I don't know if this has been your experience, sometimes you want to test it out a bit. If you're not sure if you want to raise an issue, that one of the important things is to be able to pick up the phone and talk through about thinking about raising the issue with a service. You mightn't be quite ready to raise the issue with the treating team, but you might want to talk through how you might do that, and you want to feel safe to be able to explore how to do that and not feel that the person picking up the phone is immediately going to act on something without you being comfortable about it. The other thing we heard, and it's also been in my experience in dealing with complaints processes, that it's really hard if you have to tell your story again and again. It's the worst thing. It's hard enough to tell it the first time. And so wherever possible, if you can have just one person dealing with your issue, that's going to be usually the most effective thing. Not always possible in busy offices where people take leave or become sick, or but as a principle, that's what we should aim for, so that if you're comfortable with the person dealing with your complaint, you're just dealing with one person. The other feedback we had is that the complaint systems that currently exist and will change 1st of July, is that they can be really complex, and you can go raise the same issue with a few different places. So it needs to be really clear where you need to raise your issues. And so that was part of the thinking about having a specialist body, the Mental Health Complaints Commissioner, so you can come to the one office. Because it is really hard if you're being moved from different places and trying to find the right place to raise your issues. The other thing we heard strongly is that wherever possible, if issues can be resolved at the service level, like where they're happening, and in the quickest way possible, that will be the best response. And so one of the functions of my office is to provide education and training and support to services about how to effectively deal with complaints. Part of that is about recognising when a complaint or a concern is raised, because that's often one of the first sticking points, is that the person's trying to raise an issue and it's not picked up by the service as something that needs to be acted on. The other area that was talked about was the need to use powers where appropriate to deal with the need to safeguard people's rights. And there was a sense that those powers haven't been used in the past, and my office has rightly been given a number of range of powers to be able to address issues that will be brought to our attention. And the last area is the need to work collaboratively with services to look at sort of what is the best practice, and to look at how we can use complaints to improve services. And that's the key when we think about complaints. If only we could have a different name, and I'm a bit in two minds about being called the Mental Health Complaints Commissioner. In some ways it would be nice to be called the Mental Health Speaking Out Commissioner, or Speaking Up, because speaking up has a more positive connotation than complaints. It's hard to shift that negative connotation that the word complaint has. But we need to try, because complaints are really about people's right to speak up, people's right to be heard, and the service's responsibility to take those into account and address them and improve services. So that's going to be part of our journey, is to try and think differently about complaints, and also to get services to think differently. I don't know if any of you have had complaints made to you, but the automatic reaction is to be defensive. It's sort of almost a human reaction, someone's complaining about me. So it's part of the work that we need to do with services, and what I've done in other roles, is really get services to think differently about complaints, to almost flick a switch, I'm trying to find the right word, that rather than thinking about complaints as a negative thing and thinking about perhaps what their intention was, rather think about what's the impact been for the person of their experience and how can we use that experience and understanding to improve services. This is the other thing we know about complaints. And this came up in the themes from the consultations, and it's consistent with the research around complaints. And for those of you aware of open disclosure in health services, it comes from the research of the 4 most common things that people are seeking when they raise a complaint. This is an easy way of remembering it. It's the 4 A's. So most commonly, and you can think about your own experience of trying to raise a complaint. Most commonly, the first thing you want is acknowledgement. You want acknowledgement of the impact of the adverse event or the circumstance that you're complaining about, how it's affected you or your loved one. That needs to be acknowledged first, that there needs to be real understanding of what happened and how it impacted. A really common reaction is when people are hearing a complaint, the person hearing complaint can think about what they were intending rather than listening to what the impact has been. They might have had good intentions or it might have been a mistake, but they need to put that aside and listen to what has been the impact on the circumstance that occurred in that gave rise to the complaint. The next area is answers. Often you're wanting to understand why things were done a different way or why they weren't. And you want to understand how they could be done differently or why a decision was made the way it was. Action's a big one in terms of it's either action to address or remedy the situation for you individually or how the situation could be prevented in the future. Most people who raise a complaint are doing it for themselves, but they're also doing it they don't want that circumstance to happen to someone else. And so a big part of services taking action is about action to prevent that circumstance happening to someone else. And the last thing is apology. And how hard is it to get a genuine apology? Sometimes that's the main thing that you want. I've sometimes joked I think there's a business in apologies are asked because I think it's really hard to get a good, genuine apology. The training that I've developed in other areas needs a lot of practice in terms of what's a genuine apology. And that's what came up in the consultations also. So this is a bit about us. We open 1st of July. We're counting down. We've got new staff coming on board and progressively joining the team, and so we'll be operational from the 1st of July. For those of you who aren't familiar with how we're established under the Act, we're an independent body, independent from government and services, and designed to be a specialist body. The jurisdiction is about public mental health services. So that's all we do, so that's going to be our focus. It's much easier to become good and effective if you're really focused on one area. And I think that had been some of the concerns in the consultations, is that if you're a complaints body dealing with a whole range of areas, it's hard to really understand the specific issues that affect people using mental health services. This is important to know, is that we're really committed and we also have an obligation to safeguard people's rights. It's the rights of individuals, families and carers. The Mental Health Act is a very strong rights-based act, and there's an obligation on myself and anyone working in the office to really give effect to those principles and to look at any complaint through what I describe as the lens of the rights of the person receiving services. So we're obliged to look at that. Our primary role is to receive complaints and to do whatever we can to try and resolve them, but to resolve them in a way that will improve services and the circumstances for individuals, families and carers. And this is our vision, that every complaint will be seen by services as an opportunity to hear the person, and to be seen as an opportunity to improve services. And that's what I was talking about earlier. It's about changing the thinking about complaints. It's really about respecting people's right to speak up and hearing what's not working and how it needs to be improved. And my office has been given a range of functions and powers about trying to improve services. So it's about looking at the themes in complaints, understanding the range of issues and using that knowledge to inform what areas need to be improved in the service system. And so we'll be doing that as part of our function. This is just a way of thinking about complaints. This is a quote from a gentleman in the US, and I'll read it out because I think it's really powerful. When people not used to speaking out are heard by people not used to listening, then real change can be made. And the cartoon's a bit of a giggle. I've borrowed that from the Disability Services Commissioner, and the person saying, "I don't normally complain," and the other person saying, "That's okay, we don't normally listen." Now, I don't believe anyone working in services really would say they don't listen, but it's about really listening. You can listen, but are you really hearing the whole story? And I think when people make complaints, sometimes, and if you're not sure about making complaints, you might tell part of the story. Sometimes it's hard to, and sometimes it's about reliving a really awful experience, so you might just let a bit of the story out first. But to really understand, you have to really listen, and part of our work with services will be testing that in terms of really how well are people listening when they're hearing people's concerns. And this is what we'll be doing. Our aim, and we're committed to being accessible, supportive, responsive and timely, and you might have read that in the Minister's announcements about the office, and it was certainly a theme in all the consultations. Our first job is making sure that everyone knows about the office, and so we're busily developing materials. The website's being developed as we speak. We'll be getting brochures out. We'll be doing whatever we can to get the message out in terms of the role of the office, and so people are aware that they can bring issues to us. One of the key messages will be that people can pick up the phone or send an email or access us via the website online if they just want to raise an issue and talk through it. Sometimes one of the barriers with raising complaints is feeling like you have to make a decision to make a complaint. Sometimes you just want to talk through with someone about thinking through about whether you want to raise a complaint or what it might be like. So we're encouraging people to contact us and just talk through if you've got concerns and you want to raise a complaint. And we'll be working with you in terms of whether you want us to raise it with the service, whether you want us to talk through a bit more about how you might raise it directly. So it's about having that first conversation and taking it from that point. The next point is what I talked about earlier will be one of our functions is to assist services to develop their approaches to complaints. It's really about having effective responses to complaints. We can, and we'll assist services with policies and procedures. They're important, but more importantly is that personal response in terms of hearing people's concerns and responding directly. And so we'll be doing training, working out training and education for services. And also to be working with services about, as I talked earlier, about shifting their thinking about complaints, really seeing complaints as an opportunity for learning and improving services. And one of the terms that I like to use is having a positive complaints culture. And I know, again, complaints can have a negative connotation, but having a positive approach to complaints and seeing them as people's right to speak up. We'll be taking action on issues that we identify, and we have a role in making recommendations and reports. We can make recommendations to services, to the department, to the secretary, the minister, about ways of improving services. And we'll be doing that by analysing the themes that come up in our complaints. And we have a broader role than just receiving complaints directly to us. Services have to also report the complaints that are made directly to them, and they have to do it twice a year. That's unprecedented. In most other areas, it's once a year. For mental health services, it's twice a year. So that gives us a much stronger capacity to pick up the issues that are emerging, to look at what the themes are coming up. And we'll be working with services to not only report the numbers of complaints and the outcomes or how they were resolved. That won't tell us the true picture. We'll be working with services to ask them to provide us more information about the types of issues, what was successful, how they use the information to improve services, because then we can use that information and provide back to the community, to services, and to inform service improvement, because it needs to be more than compliance. It needs to be about contribution, and that's what we'll be aiming for. And the last thing is, and that's why I'm really glad, amongst a range of reasons, to be here today, is that we want to ensure that our ongoing work is informed by the voices of consumers, carers, families, communities, services. We need to make sure that we keep hearing what are the concerns. We want feedback about how well we're doing. We'll be judged by the quality of our work and our response. And we want people to tell us what we're doing well and what we're not, so we can improve. So I hope, as I said earlier, that this is the start of many conversations, and we'll be looking at ways that through advisory groups, through consultations, through going out and speaking with groups and inviting feedback, that your voices, your ideas, your concerns can inform our ongoing work.
Now, Alex, can I just ask you, oh, you've got the website there, fantastic. Maybe you should call it the Mental Health Advice Commission, because people are always happy to offer advice on improvement, because complaints does sound like I'm going to get involved in some legal process and they're all going to know it's me. Whereas if it's a bit of advice, pick up your game or something, people might do it. Now, Alex, can I just ask you for a little overview of what you heard from the consultations? If you could sort of sum it up in a couple of sentences. What was your overwhelming response to what people were saying?
So basically, I don't want to repeat what Lynne said, but it was in line with what Lynne mentioned, the fact that the current complaints processes tend to take very long time. They're not effective, they're not timely. There's hardly any communication. So again, it's just the 4 A's that resounded the most. So the fact that they need an apology, acknowledgement, answers, action, that's you know, just the fact that people need to be heard. That's the main thing that really resounded with us. And again, what Lynne said, so I don't want to repeat
the action research and the fact that it's actually useful.
Exactly, and it's not going to happen to anyone else.
Yeah.
That's the most important thing, and the fact that what is being said is being heard, is being listened to, and is being recorded.
So are you like an ombudsman? Because that was a suggestion that this lady here just said, you're sort of like an ombudsman.
That's true.
Ombudswoman.
Ombudsman.
Do you say that?
Ombudsman, often their role is more about administrative action, about whether processes were followed or not, whereas a complaints body or a resolution process is looking at more than that. It's looking at what impact it had for you, how things could be improved. So it's looking beyond processes, it's looking about experiences. So it's a hard definition, but it's broader than what an ombudsman would look like.
Right.
Because you didn't like the complaints,
Yeah.
so you called yourself an ombudsman.
Yeah.
You go for TIO and all these other
Yeah.
ombudsmen.
They've already got an ombudsman anyway, haven't they?
Right. Yeah.
They do have one.
Yeah.
Now, anyway, we're going to get through these questions, because I know once people start asking questions that more people will be encouraged. And we're going to start with Frank, and then I'm going to go with, who was that lady over there that wanted to ask a question? Yes, there she is. Great. Off you go, Frank. Is that, oh, sorry, mate. Thank you, Rhodey. Karen?
Hello, my name is Frank Pilato. Thank you very much for allowing me to make this inquiry. Mine is not a complaint, but rather a needs-to-know basis. I've just written a few things here, so I don't expect you to give me an answer now, but following this, maybe in 2 or 3, 6 months' time, I hope I can contact you and you'll be able to give me an answer. The consumer to have the right of choice following an assessment, a timetable, a process of recovery sequence to be on a timetable. So I know once I'm referred, from the referral time, there'll be a process timed. Within a period of time, I should be able to know whether I will be able to access services, what services, how much those services will cost. Price of services required following the assessment. Service available in the area. What service available within my area? How far do I have to travel? 20, 30, 50 kilometres to actually access my service. Are those services available just public, or there are private services that actually could provide me with services that I require? When are those services available? What is the time frame? And also, will I be given, we don't know when, maybe months, maybe years. Time wasting penalties, that is, if I'm being deceived in me being referred to a service, that service doesn't put me on their waiting list, but they actually don't provide that service that I've been referred. So I think there should be a 10% plus penalty on that organisation once my final assessment price has been determined. The 10% on a daily basis should be added to my cost. The service should be person-centred services and also outcome-driven. That is all that I would like to put forward, because
I'll take this to them.
this is the situation where I'm actually at this time. Thank you very much, and if you can help me in any way, I'll be greatly appreciative.
Yeah.
Thank you very much.
Well done, Frank. Beautiful.
Thanks, Frank.
Great question. I mean, that's actually a really good question.
Yes.
Yeah.
And Frank, if I can just respond, if you were trying to get clarity on all those issues when you're accessing services and you're not getting adequate responses, that's the type of issue that you could raise, come to our office with. So you could talk through, I've tried to get clarity, I've tried to get certainty, I'm not getting proper answers. They're the types of things that you could come to our office with. And you wouldn't necessarily have to make a complaint. You could talk it through first, and we could give you some ideas about how you might seek that information, or you could raise it as a complaint. But I'd encourage you, I think under the new Mental Health Act, you've clearly got rights for that information and that clarity. It's about being at the centre of assessment and service provision, and so you've got the right to ask for that information, that certainty and clarity.
And maybe would people also, if they have questions of their service provider, ask those questions, Frank, and CC you in on the request being made, so that maybe that would be a follow-up. Did you respond to these questions from somebody? Would that be a good thing you would advise them to do?
It's with CCing correspondence, it can be a bit tricky, because usually when you CC, it's just for people's information. You're not expecting action on, and we can't presume if we're copied into information that people are actually wanting us to act.
Yeah.
So what our response would be, if we do receive CC correspondence, is to acknowledge it and say that if you want to raise that issue directly with us,
I do it to
please
frighten people,
Yeah.
though. I do it to say, I'm sending this to you and someone else. Here we
Right.
go. Someone.
I think I'll take the microphone from her. Lynne, I've got a question about the scope of your services. Two questions, actually. Were the complaints mostly about clinical services, or are you covering the community services as well?
Community service as well, so public mental health services.
Where it's forensic, and perhaps in a non-gazetted facility like MAP, the Melbourne Assessment Prison, where they've got an assessment unit for mental health, where were your sort of powers, and how will you deal with the justice system?
We're just in the process of working out those details, where we've had very recent, I'm looking at Alex, who's been involved in the discussions with Justice, Health and Corrections. There were some details that weren't included in the Mental Health Act that would have given more clarity and certainty about that. We're coming to an agreement with Justice, Health and Corrections as to how best we can respond. Our intention is to be as available as we can, and what we call a beneficial interpretation of the Act, but we just need to make sure that we have got jurisdiction. Can you comment on that, Alex?
The important thing to add is, and it's a message that we've told everyone on our consultations is that we're very open to, we're taking a no wrong doors approach. So if someone was to come to us from MAP, for example, and the service didn't fall within the MHCC's jurisdiction, they wouldn't be turned away, they'd be given the advice. So, but unfortunately I can't actually add anything further in terms of where we are in that scheme of things at the moment, but we're hoping to sort that out relatively soon.
For serious unresolved complaints that have happened in the past, like say fairly recent past, last 2 years or something like that, will you be taking those on? Will you be listening to those?
We'll certainly be listening to them. In terms of our capacity to act on them, there are some limitations. The Mental Health Act didn't provide any transitional provisions in terms of dealing with things that happened in the past, but we are in the process of just getting some legal advice about the extent to which we can go back in time, because people's experience in the past will impact on the present. It affects your confidence, and if something's been unresolved in the past, it will could have an ongoing effect. We're, wherever possible, going to be able to deal with that. It may be for some that we, with agreement with the service, that we'll try to get a common understanding or a resolution, but there are some restrictions. The preliminary advice is that we can probably look at matters 12 months back, but there'll be some restrictions, yeah.
Someone over here has asked, how will the Office of the Commissioner ensure that organisations are reporting the complaints made to them in a transparent manner?
It's a legislative obligation. They have to do it under the Act. We know all the services that have to report to us. The key will be to assist the services to have a system where it's easy to report the detail that we want. We're currently looking at a reporting tool that will enable services to collect that information in an easy way and report it to us. We do have the capacity to monitor and to ask questions of services. So if a service reports to us and they've got nil complaints, I don't think that's a good thing. It can't, the rare service where everything's going perfectly, I don't think they exist. We'd like that to be the case. So if we get reports from services and it's nil complaints, we would be asking questions, because what that would say to us is what's happening with the complaints culture. Why aren't people feeling comfortable to speak up? Or why isn't the service actually hearing the concerns? So that gives us an in terms of being able to ask those questions.
Will you be compiling and reporting the number of complaints per month or per period of time and the type of complaints on your website?
We will be, but we won't be publishing it per month. We're developing a system so that will enable us to analyse the complaints coming into our office and also the complaints being reported by services. What we hope to be able to do is to give an overview of these are the types of themes that are coming into us, and these are the things that we hear that services are dealing with, and this is what we think it tells us about what needs to happen in the service. I can't promise that it would be monthly, but we would do whatever we can to get that information out. There is a piece of work that we have to do technically in terms of developing data systems, etc., and we are in the process of trying to do that. Yeah.
Okay, Anne.
Having listened to your talk, I'm just wondering, I have a complaint I would like to make towards a mental health service. Should I go to them or should I ring your office first? Because as you said, you don't start till the 1st of July. So do the current complaint system work at the moment? Or should I ring you for advice first?
We're not actually open yet to the 1st of July, and I really encourage you, after the 1st of July, you can contact us, but I encourage you also to try and raise the issue, because the service is obliged to try and respond effectively to your complaint now. It's not a new obligation. It's not going to happen just from the 1st of July. It happens right now. They should be responding to your concern. And if you feel that they're not hearing your concerns, they're not responding in the way that you would hope, I'd encourage you to raise that with them too, that you would hope that they'd respond differently. And please contact us after the 1st of July and talk that through. through with us. Okay.
Thank you.
Yeah, hi, how you going? It's more of a comment that I have. I work for mental health services, so I've been involved for the last 10 years. And I just want to say that I'm excited actually at the establishment of having a commission because I know the system isn't perfect. And having a system in place where it allows for formal feedback would actually greatly improve the services. And I guess too, thinking about the system, it's not perfect. There's always issues that come up, and sometimes, particularly for patients that are admitted and being treated, it's hard to tease out those issues in a clinical setting. So I think it's going to be fantastic in terms of getting a formalised feedback where the service can only improve as well. The other thing too I want to mention is that my understanding is that the Office of the Public Advocate will still be available and the community visitors will still be coming to the various area mental health services and checking up on the actual services that are being provided.
Yeah, that's exactly right. We'll be developing an agreement with the Office of Public Advocate about how we'll work together and how community visitors can refer issues that they identify from services to our office. So we will be working closely with the Office of Public Advocate.
Okay, lady at the microphone.
Hi, dual diagnosis is a big issue. And I would like to ask, when the consumer approached the treating team, which is the consumer on the community treatment order, and ask his case manager, he needs help, he wants to stop the hard drugs and he needs help. Is it okay for the case manager to say, sorry, we're here to treat the mental illness? That's what happened with my son. So he went to his case manager saying, I need help, I want to stop the hard drugs. And he said, I'll get back to you. They didn't get back to him. And when I contacted them after 3 days, a long weekend, the end of the conversation was, we are here to support with mental illness. Where are we standing?
The expectations will be very different under the new legislation, where it's very clear that your son should be at the centre of that decision making. He should be making decisions as far as possible about the type of treatment he receives, and the case manager and the treating team are obliged to listen to him. So it will be a very different expectation in terms of services, and it will take some time to shift that process of focusing only on the mental illness instead of the whole person and what their desires and wishes are. And so if that process happens again post 1st of July, that's a type of issue that you could bring to our office.
Okay, question over here.
Would issues of Yep. Sorry, yeah. I was looking around. That's all right. Would issues of negligence and things like that, would that also, is a consumer or someone who would like to make a complaint about, negligence, somebody, a psychiatrist or some health profession didn't do the right thing, would that be you, or could that make the complaint as well, or anyone?
If it's about a public mental health service, yes. If you feel that the treating psychiatrist or the treating team hasn't addressed a need or has done something that's put your or family member at risk of harm, that's certainly something that you can raise with our office.
Okay, other questions on the other side of the room? How are we going? Close to finishing time, folks. Was there someone else put their hand up over here? Yep? No? Here we are, Dal.
I was looking at you before, that's where I got confused.
I'm sorry, I was just trying to say to the lady who made that complaint, Denise, is it? That I was outraged and that isn't how all public mental health systems operate. They're meant to be no wrong door. They're meant to be dealing with both things, and many clinicians that I know are. So I think she should be taking it up locally and perhaps be supported to do it before she comes to you.
Yes, I agree. Yeah.
So Frank, you're going to be got back to, we hope. Do you feel you've had enough? So you just wanted to ask those questions, and you want to know that after this all comes in, that all of those things will be gone through with you?
I think I might be able to provide you with an answer to one of my questions, and I will be providing you with a written.
Sorry, oh, there's two more here. Great. Okay, you go.
Could you tell me how easy the process is to make a complaint? I mean, is it pages of paperwork? Does it require the internet? Does it... And when I ring up for a chat, when does it turn into a complaint? Can it do that?
It'll be totally at your choice as to when it's dealt with as a complaint. So we won't deal with anything unless you give us agreement in terms of taking it up with the service. So you'll be in control of that process. We can take complaints orally. The Act does tell us that complaints, when we deal with them more formally, need to be confirmed in writing, but we can help you do that. For instance, one of the team can actually write up your concerns and either send it back to you or read it back out to you to make sure that we've captured it correctly. That's the other thing we need to be careful about if we're writing a complaint for someone else. We want to make sure that we've got it in your words and your concerns as far as possible. The complaint form won't be complicated. We'll probably have to ask different parts of information along the way. Some complaints we might be able to deal with just purely by verbally. For instance, if you ring us and you raise a concern and you give us agreement that we can contact the service, and we're able to contact the service and speak to the person who can address your concern, we might be able to address it just like that. One of the things we can do is do telephone hookups. Because if it's something, for instance, trying to get an explanation or an answer or an agreement about doing something differently, we might be able to do that on a phone hookup. Where we need to be careful is that not getting caught up in the paper warfare. And I don't know if that's any of your experiences been like that with dealing with complaints, is that once you put a complaint in writing and you send it to the provider and then they write their response and then it comes back to you, it's the rare written response that ever meets the mark. Even if it's well intended, once people put things in writing, it's really hard to give that acknowledgement or to really feel that you've been heard. Some things do have to be documented, and we'll be making judgments as to what things we need in writing and what questions we need to ask, but we'll be trying to minimise that process because experience shows us that as much as you can do by verbal exchange and then confirm agreements in writing, that's usually the most timely and effective way of dealing with things.
Will a carer be able to make a complaint about their own experience of or response they've had from a mental health service? Say, for example, around if they feel excluded or they haven't been provided with information they need to care for their loved one, or can they only make a complaint around the treatment of the consumer?
The way the Act's worded is that you can raise a complaint about relating to mental health service provision. Who can make a complaint as a consumer, someone who's raising issues at the request of a consumer, or someone that we're satisfied has a genuine interest in the well-being of the consumer. The Act also has a real principle about respecting the role of carers. That's not stated in the provisions that deal with complaints, but we're obliged to uphold the principles of the Act. So we would say yes, even though it's not explicit, we would be taking complaints and dealing with complaints that affect carers.
Oh, that lady asked how many staff do you have? That's a good question.
So I've got two questions. The postal address, it's level 26, 570 Burke Street, but we'll be distributing that information very shortly. The website's just in the process of being built, and so we'll be providing that information. There was another question.
How many staff do you have?
It will be up to 17 thereabouts. We're building the staff group progressively. And that includes part-time, full-time.
I was just going to ask in regards to cold communities or cold families,
Yeah.
what you have in provision for them if they need to make a complaint? Interpreters or enabling someone else to maybe speak on their behalf.
Definitely, yes. We'll be putting any process in place that's necessary to be able to make the process accessible and culturally responsive for cold communities.